everyone to this video podcast. I'm your host, Ali Mohammadi. Today, I have the privilege to interview Dr. Banafcheh Hejazi, and where we will be discussing the challenges of family medicine practice during the COVID-19 pandemic. Dr. Hejazi is a family doctor and a clinical professor at McGill's Faculty of Medicine for the past 20 years. Mental health is one of her major interests, and she broke the taboo of suicide and burnout of doctors by making a documentary called Doctors Also Cry, which was broadcasted on CBC, and since then she's been giving conferences all over Canada and has continued breaking this taboo. Dr. Hejazi, welcome to this video podcast. How are you today?
Hi, Ali. How are you? Thank you so much for inviting me. It's always a pleasure to have a beautiful discussion with you.
It's a privilege to have you, Dr. Hejazi. As you know, the recent months have been quite challenging for all of us.
Yes.
How are you doing as we are heading into this second lockdown?
Resilience is the world, is really what we have to work on. That's what I said last March. I continue to say that this is what we have to do since we have a few months to go. I mean, the good news is that the vaccine is out. The government started vaccination last week. It's a slow process, it's true, but a few months and we should see some sunshine coming.
So there is light at the end of the tunnel.
Absolutely.
Very good. I know that you're very active in the field of mental health. As I mentioned, you did do a documentary called Doctors Also Cry. In terms of mental health and physical health, how are these two affected by the COVID-19 pandemic?
So COVID-19 pandemic is really usually compared to a war situation. The last pandemic was close to 100 years ago. And right now what we are going through can be compared to a world war. So definitely the mental health and the physical health are affected. And not unfortunately for now, but for the next few years, we will see also more consequences. So what I can say for now, what we have noticed for, first of all, mental health, which is more affected, is post-trauma stress, anxiety, burnout, depression, suicidal ideas, and family violence. We see that also. Physical health is really also affected. So we see more abuse of cigarette, of alcohol, of drugs. There is a term called COVID-15 because this is usually the amount of pounds that people have gained during the pandemic, and sometimes unfortunately more. So it's not easy. It's not easy as a family physician. I'm trying to put water on fire. And I know my job for that is only starting for now, unfortunately. A lot of unemployment, so economy has been affected. It's not easy. It's not easy.
I think in my case, it's more like COVID minus 15. But
you're among that 5%.
I'm among that 5%.
Yeah, you're lucky you.
Dr. Hejazi, you mentioned about burnout. How concerned should we be about burnout in the population?
So first of all, let me explain what is burnout. It's very important to understand that burnout is not considered a disease by the medical field, but is a syndrome. And it's specifically related to work environment. So unfortunately, burnout has increased. And something we noticed also is that there is more burnout among women than men. There is a number that came out recently. 67% of people who lost their job are women. Mm-hmm. So that is really affecting much more women than men. And it will just continue. This is really bad because we know that the consequence of a burnout eventually can be depression, can be suicide. So right now, the amount of burnout is quite high, and unfortunately more in women. And last summer, when they restarted hiring again, we unfortunately noticed that they were hiring more men than women, finding then, because for women, there's always the conflict between work and family. That conciliation was already there. The problem was there, it's true. There is a term that is not very known, but we use it more and more, called invisible work. This is the work that women do at home, which in average goes between 25 to 35 hours a week. This is to do all the things we have to do at home, and take care of the kids, and cleaning and cooking. And of course, when the parents or the in-laws, they get older, we also, women, we have the instinct of taking care more of these elderly people. So we are called the sandwich generation. So this is a lot, Ali, 25 to 35 hours a week, called invisible and not really always appreciated. I'm not having at all a feminist speech there, but I know men are more and more contributing to work at home. But again, the study shows that it's more in kids' education and not in the everyday work at home. So this is something that is there and is affecting women. But in general also, what we notice with the virtual work is that it's speeding up the expectation of the companies. So I hear some patients letting me know that they are getting emails at 6 a.m., at 11 p.m. during the weekend. And because they are cutting staff, the expectation, the speed is really a disaster. So already you're home, but the amount of job doubles or triples. So for sure, it's not easy. And also you have kids at home. I mean, the first period of from March to June, kids were all the time at home. Now some of them are home, some of them are doing virtual, but you have all this family at home. You have to do virtual work, and the virtual work is demanding more. So these are all factors that are increasing among men and women, the burnout, that's for sure.
Very good. And you also mentioned about family violence. I've personally read articles that it has been on the rise since the beginning of the pandemic. What's your opinion about this?
So I've been working with a center for family violence called the Shields of Athena for over 20 years, which is a multi-ethnic center for women. I have the pleasure of working with them, and with checking the numbers with them and other centers. And internationally also, what we notice is that there is an increase of family violence about 30%. Not only that, but the form of violence is also more severe. Those centers, they report that about 50% of the violence reported is more severe. So it could be physical, it could be psychological, it could be financial, because don't forget, you know, when we talk about family violence, we always think it's just physical, but it's not. It could be mental, it could be financial. There's all kinds of violence. And for sure, the main factor for that is the isolation of women. I mean, this is the dream for the manipulator and the aggressor, because even before COVID, the dream of the manipulator is to isolate the victim. And COVID is bringing that as a gift on a plate. The woman is isolated from her family, her friends and colleagues, because that's also another part of the virtual work. You know, we talk about virtual work, how amazing it is and has accelerated because of COVID. But at the same time, we are seeing the bad side, like I mentioned, the high speed, the expectations, but also for family violence, virtual medicine means that the victim is not in touch with the colleagues. And now when some women, they ask to come once or twice a week, to their work and not be virtual, there is a reason why that person is asking that. So the government is really encouraging those companies to allow, if she wants to come to work once or twice a week, maybe to take a break from the kids, maybe because there is family violence, you have to let her in.
Okay. What are the solutions, in your opinion, to stay more healthy? I mean, you mentioned that people maybe want to go back to work more, back to what it was, 10 months, 11 months ago. But in your opinion, what are some of the solutions to stay healthy?
I think it's very important to keep a routine, because with COVID, what happens is that people who are virtual, they're not gonna wake up or sleep the same hours. The eating habits are really bad right now. And like I mentioned, more alcohol, drugs, cigarette consumption. So it's really, really important to work on that. I know it's winter now. Summer, I would tell my patients, go out, do sports, do activities. Unfortunately, right now it's cold, but we have outdoors activities, winter activities. Myself, my resolution this year is to learn ski. So I've been in Quebec over, I would say 25 years now. And that's it. For the holidays, I want to go learn ski. Why not? This is the best opportunity for me to do that. I'm scared, but I'm going to work on that, and it's going to be an outdoor activity for me. So I think there is always possibility to do things. And don't forget, we just have a few months to go. March, April, the situation, like you said, there is a light at the end of the tunnel. Last year, this is not what we were talking about. Right now, the vaccine is out. There are really good things going out. So I think just to work on that for a few months, we should be fine.
Very good. And what about the effects, Dr. Hejazi? The effects that, let's say, will be in April, May, June. What is the post-pandemic effects, in your opinion?
Mental health, definitely, the issues are going to stay with us. So as a family doctor, for sure, I will work more and more on that. That unemployment thing is going to be going on with us. The people who are going through burnout, anxiety, depression are going to stay fragile for quite a while. A lot of separations, a lot of family violence, these two, we have to work on that. So, and people who gain weight, it's going to take time. It's so easy to gain, but it's so hard to lose weight. And, the diabetes are going to be upside down, the hypertension, the cholesterol, the everything. So as a person who works in first line for health, mental and physical, wow. First of all, for sure, I'm going to take a big vacation. Because it's been a year, I didn't take vacation. My mistake last summer, I should have done it. So I've been going on and going on and going on. So for sure, I will need a lot of energy, because after the pandemic, like I said, it's going to be like a post-war situation. So there's going to be a lot of things to improve, and that's going to be over a few years for sure.
Well, I wish you a good vacation in advance.
That's not for now. That's after I get my vaccine.
After you get the vaccine.
I'm on the list, and hopefully in January, end of January, I should be. By the way, I really suggest for everyone to get the vaccine. We know for a pandemic to be resolved, we need 60 to 70% of the population to get the vaccines. Right now, the one we have with the Pfizer, the only problem is for the people who have severe food allergies. But for the rest, if you get called to get it, because we see a lot of people refusing it for now, but to really be able to fight the pandemic, vaccination is the solution.
So you believe that the rollout will be successful, and hopefully by fall of 2021, most Canadians will be vaccinated?
I hope so. I really believe that. And I'm very proud to know that our country has bought so much vaccine. I think we have the highest rank, and we are ready for everybody, in opposition to some countries that decided not to buy the vaccine. So, I'm Persian, I come from Iran, and I just found out yesterday that for now they are not buying any vaccine. So, we're lucky. We have the option of getting the vaccine, so it's a blessing.
For sure. And about virtual medicine, you mentioned that you've been working for the past year, and most of it has been done virtually.
Yes.
Do you see that staying post-pandemic, virtual medicine, and what are the benefits and limitations of virtual medicine?
So it's been a few years that we hear about virtual medicine, and Canada is also a country very interested in that. We know that with time, the population is going to get older. We have a lot of elderly here. Also, we're going to have a huge lack of staff as doctors through the years to come. So for sure, virtual medicine is a good option. And because of COVID, we got all pushed into it. So personally, for me, I have to clarify that in my case, the virtual is mainly a phone. I don't have a platform. The government didn't, I mean, it went so fast, they didn't install any platform. So it's not through Zoom or anything. I really do it on the phone. And of course, if there are things they want to show me, they take pictures and they email it to me. Since summer though, I have to say I'm doing 50-50, meaning I do 50% virtually and 50% at the clinic. So there are a few days that I go because, like you said, what are the limitations? Yes, there are really limitations. I would say maybe we can keep it for 30 or 40%. There are things that we can discuss on a platform with a patient, but there are other things that we have to see the patient, examine. I mean, a heart exam, a lung exam, the vital sign, even I would say in a case of a depression, imagine a patient who has to go in front of the computer and talk about depression. You know, the it's not the same vibe, you know, and there are also some signals you get without the dialogues when you are in front of the patient that with the virtual medicine you will not be able to understand or feel. The human side in medicine, I believe, is very important. I know that for many years they were even talking about that robots are gonna eventually replace doctors. I really don't believe that. I think it's a great lesson we are learning with COVID that yes, virtual medicine had its place, but I don't think it could ever replace a human. Patients, they tell me, Dr. Hejazi, we're missing you. We want to come see you. There are things we are not comfortable. It's not easy for us. Even younger generation, I'm not talking about elderly only, they like it, that contact. You know, sometimes there is even maybe a placebo effect that because they come to see me and I talk to them and I reassure, they feel better when they leave the office. So I feel that yes, the humans in medicine, they have to stay, and virtual medicine can be there for some situations, but not for all.
Very good. I mean, I'm hoping to be vaccinated by a human, hopefully. Uh, Dr. Hejazi, you mentioned that you're active in several groups and organizations like the Shields of Athena. Are there any other organizations that you've become active in the past few months?
Yes, so I've been involved for the Medical Association, the Canadian Medical Association. Before COVID, we were touring all around Canada with the conference for mental health and showing some parts of my documentary. I also continue making documentaries. The next one, it was supposed to start last March, for anxiety among teenagers, which also, by the way, Ali, has increased. I work at the teenage unit of the Jewish hospital, where unfortunately we see that increasing, the social anxiety, the performance anxiety. It's not easy for kids to study virtually. And the high schools, you know, I think it's secondary 3 and more, and college and university, the concentration, it's hard. It's really hard to be in front of a computer the whole day. So we see that a lot of kids are failing their courses, and this is creating a lot of anxiety for them. So this is also something I'm working at. Hopefully after COVID, I'll do my third documentary about that. And it's going to be also the impact of art on anxiety. So I'm looking forward for that. And since last summer also, I'm working with the organization affiliated to the United Nations called IHAN, International Health Awareness Network, which take care of women and children health around the world. And I was supposed to travel with them. So hopefully next year we'll be able to go around internationally and give conferences for that awareness for women and children. I'm very proud to be a member of this association.
Very good. I wish you all the best and all the luck with the new involvements. And you mentioned about art. I hope that performance and art makes a comeback post-pandemic.
I
Dr.
miss
Hejazi?
going to your comedy shows, by the way. It's amazing, and I'm happy this summer I was able to come and see your show, and we need laughing. And I really admire what you do, making people laugh. And honestly, this is the best treatment for depression, burnout, anxiety. And for some people, I definitely believe it could replace the medication. So we need shows and people like you who are committed to make us laugh. And I can't wait after the pandemic to continue going to your shows. They're amazing, by the way. Continue the good job.
Thank you very much, Dr. Hejazi. I'll be producing a lot of shows as soon as we're allowed to resume activities. I want to thank you for joining us. I know that the past months have been difficult, but I'm sure we're going to take away a lot of lessons from this pandemic, which will hopefully better the society and the world around us.
Absolutely.
So thank you very much for being with us and enlightening us with your expertise. Dr. Hejazi, is there anything else you'd like to share before we conclude?
I want to wish everybody happy holidays and 221 year full of happiness. And like you said, all these projects that everyone is holding, I'm sure we will be all able to realize them. So, and we are most of us staying here in Montreal during the holidays. But like I said, there's always a way to do things. For me, it's going to be skiing. I hope I'm not going to die. I have a very bad phobia about skiing, but that's it. I'm gonna fight that this winter. I'll let you know what happens.
Very good. Just make sure you take an instructor for
Yeah.
for
Oh
the
yeah.
first time. Okay. Very good, Dr. Hejazi. I wish you a good day, and again, thank you for being with us today.
Thank you.